Did you know nearly 1 in every 3 adults over the age of 65 fall every year? Even more surprising, most seniors don't even tell their doctors when it happens.
Here with more about the dangers of falling and the importance of fall prevention and bone health is Healthcare Partners clinical educator Aliberti. Good morning to you. How are you?
I'm very well.
Great.
Thank you. Thanks. Nice to be here.
It's great to see you again. Falling, as you know, at any age is very scary, but why is it so critical when an older person falls?
Yeah, that's a great question, Dow. According to the Center for Disease Control and Prevention, about 20 to 30% of seniors fall every year, and a lot of those result in cuts, fractures, and head trauma. And when that occurs, it really affects the senior's ability to stay independent and also affects their quality of life.
And we mentioned that they don't report it.
They don't report it, you know, especially if they don't get injured. They think, oh, no big deal, but what really happens then is the senior changes their activity level because they're afraid they're going to fall again and be hurt, and that sets up a really dangerous cycle where they're not staying strong and doing their regular activities of daily living.
So if something should happen, you know, what's the recovery process like for a senior?
Well, it's a great question. Since so many of them result in fractures, that they can have complications up to a whole year. So a lot of them have to end up going into rehab, and then if the fall's very bad, they could potentially affect their actual living situation. So we don't want to have that happen. And at Healthcare Partners, we have so many opportunities to coordinate care and to teach our seniors and their caregivers how to stay safe and healthy.
And new parents, as you know, they go around their house, they baby-proof their home. But you also suggest for seniors to proof their home as well, because there are certain things that can trigger a fall.
That's exactly right. So some of the things that you can do out in your home is make sure that you've got potentially grab bars in your bathroom, around your toilet, around your bath. Put in a mat in your shower. Have some light in your hallways. Get rid of those throw rugs, throw them away, and be careful what kind of shoes you wear. No more stilettos.
Tennis shoes, things with traction, right?
Thanks for that visual, Ellen.
You're welcome.
Obviously, maintaining a healthy lifestyle is important. Would you say it's almost, you know, creating a strong body is very key to so nothing ever does happen?
Absolutely. And at Healthcare Partners, we have an innovative total care model where we're helping our seniors learn how to stay safe and take care of themselves and stay as healthy as possible.
What kind of tips would you give, you know, someone at home, perhaps, for creating that healthy body?
Well, that's a great question. So we want to be mindful that a lot of our seniors have osteoporosis, which is porous bones, or they have low bone density. So what do they need to do? They need to begin to exercise, and I'm not talking about, you know, severe cardiac exercise, but walking, jogging, and even dancing, okay? All those things can help. You want to maintain a diet rich in calcium and vitamin D.
Do you offer services for seniors?
We do. We have the total care model, which is makes a senior have an entire team focused on them. Doctors, care managers, care assistants. We can help you coordinate care, transportation. We can even give you a diet of things that you should have to buy to stay healthy.
So it's really about the mind, the body, nutrition.
Total.
Also
what was it called?
The total care model.
Total care model.
Yes.
And there's something that's happening right now called open enrollment that's very important for seniors to remember and take notice of. What is that, and when do we sign up for that?
That's a great question. We're actually in open enrollment right now, and what I really want to impress upon our seniors or Medicare recipients this year is that not confuse it with the Affordable Care Act, because those are two different events. Open enrollment for seniors, this is when they make decisions about where their Medicare and their medications as well. And we would hope that they would consider coming to Healthcare Partners and be involved with us in the total care model.
And that open enrollment, as you said, it's going on right now, and it closes in December?
Right, so it started October 15th. We're going to keep going until December 7th.
What's the best way for seniors to learn more about it?
Thanks, Jeff. They can actually ask at their healthcare partners clinic. We also have a website, www.hcpnv.com. We've got a lot of events going on. This open enrollment, so seniors can learn about benefits, and they can also learn about healthcare partners and how we provide care to all of our patients.
And again, if a senior falls, but it's nothing that they want to go to their doctor about, but they should really still tell someone, just because it might cause something down the road.
Right. They should always tell their doctor when they've fallen, so we can see if there's anything we can do. Medications, visual problems, problems with gait and so forth, all of those things can be addressed. We just need to know. So share with your doctor. Full disclosure.
Yes. Thank you, Ellen.
Thank
Some
you,
great
Ellen.
information
Great
for
to
us.
see you. Thank you so much.
For more info on and tips to reduce the risk of falling, or to learn more about the open enrollment process, Healthcare Partners Nevada can help. Just check out the website you see right there on your screen. Still to come.